If you're concerned about facial development for your children or identified a problem with tongue resting posture in yourself, you can get help now. Luckily, there are more professionals than ever who are treating these conditions early to promote good facial and dental development and possibly avoid braces down the road for children or relapse after orthodontic treatment. Many of these conditions are apparent at birth. Babies are being born with recessed lower jaws, tongue and lip ties, or are mouth breathing during the day and night, and they need immediate treatment. Myofunctional therapy can correct or rest postures of the tongue, lips, and jaw so the teeth and face can develop naturally. This therapy is typically appropriate for children 5 and up, but we do have other things that we can do for children that are under 5, and we'll talk about those in a minute. So step 1 is the evaluation. The first step is to have it as evaluation, and this is a comprehensive assessment of function of all of the oral structures, including a detailed case history since birth. This evaluation can take up to 2 hours and yields an 8 to 9 page report with recommendations, referrals to other professionals as needed, and a plan for treatment moving forward. Step 2 is therapy. Your therapist will typically recommend weekly therapy and assign 3 to 4 exercises that have to be completed at least twice a day. For example, something like putting the tongue up behind the top teeth, but not touching the teeth, and holding the tongue there for 30 seconds is one type of exercise. Sounds pretty easy, right? But of course, there's requirements such as the mouth is open wide, the tongue is not allowed to move. You'd be surprised how many people cannot do something that seems so simple, especially when it comes to not moving the tongue. How long does this therapy usually take is usually the next question we get. Typically, with good practice, the total number of sessions ranges from 16 to 24 or 4 to 6 months. But missing daily practice can extend the program, while completing the exercises with consistency can shorten it. How much does it cost? This is usually the next question, and definitely an important question. Each myofunctional therapist or orofacial myologist has their own pricing, so it would be inappropriate to post that information here. One thing to consider is that you're paying for a specialized, tailored, and highly individualized therapy that only a few hundred people in the country can provide. Additionally, while the cost of braces continues to soar, people still seem to figure out a way to pay for them, yet attempting to correct the problems that may lead to needing braces or preventing relapse is judged to be too expensive. Luckily, the cost of myofunctional therapy is not even close to the cost of braces, yet it can do so much more for your overall health. Will insurance cover it? Unfortunately, most insurances do not cover it. In our office, we can file with your insurance so the cost is applied to your deductible, but in our experience, this therapy is typically not covered by insurance. What do I do next? You can call our office and begin the intake process. And for the evaluation, our number and all of our contact information is listed here. We also complete evaluations and therapy online to make getting treatment on therapy easier for our families. So as I said before, for children under 5, they're not typically candidates for a typical myofunctional program, but it doesn't mean that they wouldn't benefit from an evaluation, as we can identify any issues that may be leading to more serious myofunctional problems down the road. We'll also assist the parents for providing necessary information and referrals for airway and tongue resting posture. Additionally, we have other treatment modalities that will put them on the right track for good facial development. Our goal is to normalize resting postures of the tongue, lips, and jaws so that healthy facial and dental development can occur naturally, which in turn creates healthy airways and allows the patient to have great sleep.